Hi, everyone. I'm Mary Opperman, Vice President and Chief Human Resource Officer, and I'm so pleased to be joined today by Dr. Ann Jones, Director of Medical Services for Cornell Health. Ann, up until recently, we've had very few employee cases here on the campus, but that's starting to change a little bit, isn't it?
Yes, Mary. So our community for so long had been doing well. And had been protected by many factors. But it is true that in the last couple of months, there has been a rise and really a sustained number of cases. There were 4 cases in 2 days, as was mentioned in your message in the provost, and several more have continued to evolve and emerge over the course of October. A few things to note, though, is that there's no indication of these cases being related to clusters, but that many community members that live both in Tompkins County and in the counties neighboring have been affected. And so we know it's been affecting our Cornell community in those ways.
Right. We know that we're seeing more cases than we had here in Tompkins County, and some of our surrounding counties are really having kind of a tough time right now. And we know that many of our employees and their families live in the surrounding counties. It really does make our work here on campus, using the daily check and doing surveillance testing, so important. And we have, about 1,800 of our faculty and staff who test twice a week, and another almost 2,800 who test each week. It's really critical that we all take those very seriously and that we continue to be diligent in our day-to-day activities.
Absolutely. Diligence is very important, especially as the weather gets colder and we find ourselves having to make different kinds of choices about how we socialize with each other, but do so in a physically distanced fashion, to not get complacent, but to continue to do all of those things that we know are important: the physical distancing, wearing masks, washing your hands, avoiding touching your face, nose, and mouth. Even as people have done all of these things, someone can do all of those things and then still get COVID. We've been seeing that there's been some stigma attached to either having an exposure, having to be in mandatory quarantine, or having the illness. And I think that we as a community, as a caring community, really hope that we can come together when those things happen. And I think what's also really important is complying with the evolving recommendations from our public health partners in all of our neighboring counties and in Tompkins County. It's also a really important time to make sure that we get vaccinated for the flu as the season approaches into the winter months and into flu season.
Thank you, Ann. We're so lucky to have you in our community, and the many other health officials that are helping us as well. Our local partners in Cayuga Health, as well as our health department and the health departments in the surrounding counties. We're very fortunate to have all of you. And as Ann said, we are a community. We will get through this together. We believe in all of you. We support all of you. And I just want to thank you once again. Thank you so much, Ann, for being here with us today.